requirements. 6 on Your Side's Jessica Taylor shows us how ICOM students are helping address the need.
Students at Idaho's first medical school spend the first 2 years learning from textbooks. Years 3 and 4 are spent out in the field doing clinical rotations.
They always say that patients don't present like the textbook.
4 weeks of those rotations are spent on psychiatry. Idaho lacks psychiatrists across the state, with rural areas getting hit the hardest, something Starks has seen firsthand.
There's a lot of rural and underserved communities that just don't have great access to healthcare. So that was what was important to me when selecting a school, was being able to be trained and have the knowledge to be able to give back to those certain communities.
ICOM has partnered with Pearl Health Clinic in Ammon, Idaho for their students' clinical rotations. The clinic gives students that first-hand experience while addressing the need for psychiatrists in more rural areas of Idaho.
Their physicians, again, will work with students and patients and allow students to have access to patients with mental health conditions and learn about them, because a big part of, especially if you're in primary care, probably 30 or 40% of what you do as a primary care physician involves mental health care and psychiatric care.
Students will spend their entire third year living in communities where their rotations are, including the Treasure Valley, Magic Valley, and eastern Idaho. The hope is more students will choose to practice in Idaho once graduation time rolls around.
It's definitely going to be more overwhelming to work in those rural areas, but it's also going to be more rewarding too, because you're able to, go to these places that otherwise wouldn't have the care.
Jessica Taylor, 6 on Your Side.